Ashley Graham had her twins, and she used her incredible pregnancy journey as a platform for a body positivity campaign. Through this process, she's shared with all of us what are the normal changes that happen to everybody during and after pregnancy, and I love that. I want you to stay tuned through this video because at the end, I'm going to share with you the one thing that this plastic surgeon knows every single woman has to do after her pregnancy. I think the most important thing in understanding where Ashley is coming from in explaining what are normal changes after pregnancy are to talk about what are normal changes after pregnancy. I always break it down into the changes that happen to your skin, to the fat underneath your skin, and to the muscles under that fat, the muscles above and holding in all of your organs, intestines, and stuff like that. Okay, skin. Your skin changes during pregnancy. How? So the most obvious way is, look, there's a baby pushing on that skin from the inside. So the skin stretches out and in most cases does not completely shrink back to how it was before pregnancy. Also, during that stretching process, the skin can literally tear from the inside, and that can cause the stretch marks that you might see after pregnancy. Finally, the skin can actually thin. It can change its characteristics, it can change how it works, and those are all things that are completely normal after a pregnancy. Next, let's talk about the fat. Your body's fat definitely changes during pregnancy, and that's both local and distant. So in the area of the abdomen, some people will gain a little fat underneath the skin, some will actually lose fat in that area. Also, the fat distribution in your body can change. You can start to get fat in places that you did not have before. Finally, in interesting ways, the quality, the consistency of the fat can change, and even the way your body just manages calories and distributes it throughout can totally change after pregnancy. And guess what? Just like everything else, that is completely normal. Okay, finally, there are the muscles. This is the best way to think about it. You've got those two vertical six-pack muscles, the rectus abdominis muscles. They go up and down. Well, when you have a baby, that little thing is in there pushing against those muscles. When the baby pushes against those vertical six-pack muscles, it separates them apart. It creates what's called a rectus diastasis. And to some extent or another, every single mom has a degree of rectus diastasis. For some, it's minimal. For some, it's super wide. So that's one change to the muscle. The other is that very often, as a part of that stretching, the muscle can flatten and thin out. So its whole shape can change. There may be actual implications in your strength and movement as a result of those muscle changes. All right, so those were all the normal things that happen after every single pregnancy. This is the time when we can jump into what we can do about those normal changes after pregnancy. And I promise you, I am going to get to the one thing that I tell every single mom she has to do after her pregnancy. Okay, so talking about extra skin, let's talk about the things we can do to treat that skin. So the most definitive thing to do is, of course, to cut out all of the extra and damaged skin. That's usually done with a tummy tuck or a mini tummy tuck. Now, another thing we can do is to try to tighten that loose skin. And my favorite device for that is Renuvion, something that goes underneath to shrink down the skin. Finally, there are more localized treatments we can do to improve the actual surface and quality of the skin. Things like laser, microneedling, radiofrequency energy, even tattoo to help color in the stretch marks that are dark or light. Next, let's talk about fat. How can you manage the fat? So the most definitive way, like with skin, is to physically remove the excess fat. The best way to do that is with liposuction. That's something that's done all the time in body contouring, both in the context of pregnancy and not. There are also some non-invasive fat reduction techniques, which quite frankly, I'm not the biggest fan of because they just don't work that well. Those are things like Kybella injections or cool sculpting. Finally, and probably most importantly, with everything, diet and exercise. It is so important that you take a holistic approach to your entire post-pregnancy journey, and nothing is more important than diet and exercise. Okay, finally, let's talk about the muscle. And I promise I am going to get to the thing that I tell every single mom she has to do after her pregnancy in just 1 second. So, what is the thing we can do to most definitively repair the changes that occur to the six-pack muscles after pregnancy? Well, surgery is the most definitive approach. So during a tummy tuck, what we do is we take those two vertical six-pack rectus abdominis muscles and we sew them together to close that rectus diastasis gap. That will flatten the stomach, bring in the waist, and actually can improve your core strength and mobility. So that's surgical, that's a big procedure. There are other options. A non-surgical approach is a machine like M-Sculpt that will stimulate your abdominal muscles to contract and strengthen and may actually close that rectus diastasis a little bit. Most importantly though, and something that should be done regardless of what approach you take to your muscle changes after pregnancy, is great physical therapy, strength training, Pilates, yoga. Stuff like that will actually strengthen the muscle and in many cases bring down that rectus diastasis gap. In my mind, those should be done all the time after pregnancy. They really work beautifully. Okay, so we've talked about a lot. I've talked about the changes that happen during pregnancy. I've talked about the things that you can do about those changes after pregnancy. And I want to circle back here to what started it all. Ashley Graham used her pregnancy experience as a platform for body positivity. And it's really in that vein that we can finally get to the one thing I tell every single mom that she has to do after her pregnancy. The one thing you have to do after pregnancy, are you ready? Not a goddamn thing. You do what you want to do. You do what you need to do. There is no right answer. The important thing here is you have gone through a miracle of a process. You have brought life into the world and your body absolutely has changed because of it. There is nothing bad about it. There is nothing wrong about it. All that matters is, what do you want out of your body, out of your life now that you've gone through this? A lot of my patients choose to make changes to their body to help bring them closer to where they were before their pregnancy. You know what? A lot of my patients, and certainly people I've never met, choose not to do a single thing, and that is equally perfect. So just remember, the decision is yours and yours alone, and whatever you do is the right decision.